When auscultation patients breathe sounds, the nurse detects a continuous sound heard on expiration. The nurse identifies this sound as A. Crackles, B. Wheezes, C. Bronchial sound, D. Pleural friction drop. And the answer is B. Wheezes. If a patient is unable to breathe in horizontal position, it is called A. Dyspnea, B. Hyperapnea, C. Orthopnea, D. Apnea. And the answer is C. Orthopnea. A state where there is inadequate supply of oxygen to the tissue is called A. Anoxia, B. Apnea, C. Asphyxia, D. Cyanosis. And the answer is A. Anoxia. Which of the following is considered as bronchodilator? A. Acetylcysteine, B. Guaifenesin, C. Theophylline, D. Epinephrine HCl. And the answer is D. Epinephrine HCl. In emphysema, there is decreased oxygen supply because of A. Pleural effusion, B. Infection obstruction, C. Loss of air space, D. Respiratory muscle paralysis. And the answer is C. Loss of air space. Which of the following term correlates with the bronchospasm of the bronchial walls? A. Wheezes, B. Stridor, C. Rhonchi, D. Pleural rub. And the answer is A. Wheezes. The term atelectasis refers to A. Collapse of alveoli, B. Collapse of blood vessels, C. Air in the pleural space, D. Blood in pleural space. And the answer is A. Collapse of alveoli. The earliest sign of hypoxia is A. Restlessness, B. Anxiety, C. Anemia, D. Dyspnea. And the answer is A. Restlessness. Obstruction of the passageways in respiratory tract may lead to A. Respiratory acidosis, B. Metabolic acidosis, C. Respiratory alkalosis, D. Metabolic alkalosis. And the answer is A. Respiratory acidosis. The nurse understands that in absence of pathology, a client respiratory unless is stimulated by A. Oxygen, B. Lactic acid, C. Calcium ions, D. Carbon dioxide. And the answer is D. Carbon dioxide. Type of breathing found in ketoacidotic coma. A. Deep and rapid, B. Swallow, C. Fast, D. Slow. And the answer is A. Deep and rapid. Pulmonary embolism is complication of surgery. A. Hysterectomy, B. Appendectomy, C. Vein ligation, D. Prostate surgery. And the answer is A. Hysterectomy. What is the route of transmission of tuberculosis? A. Airborne route, B. Blood, C. Fecal-oral route, D. Hand to mouth. And the answer is A. Airborne route. The most common causative organism for pneumonia is A. Staphylococcus, B. Pneumococcus, C. Haemophilus, D. Klebsiella. And the answer is B. Pneumococcus. To remove the air in case of pneumothorax, the physician usually introduces needle and rubber catheter in A. Fifth intercostal space, B. Fourth intercostal space, C. Sixth intercostal space, D. Eighth intercostal space. And the answer is A. Fifth intercostal space. A nurse is suctioning fluids from a male client via tracheostomy tube. When suctioning, the nurse must limit the suctioning time to a maximum of A. 1 minute, B. 5 seconds, C. 10 seconds, D. 30 seconds. And the answer is C. 10 seconds. A nurse is caring for a client with emphysema who is receiving oxygen. The nurse assesses the oxygen flow rate to ensure that doesn't exceed A. 1 liter per minute, B. 2 liter per minute, C. 6 liter per minute, D. 10 liter per minute. And the answer is D. 10 liter per minute. Which of the symptoms is most characteristic of a client with a cancer of the lung? A. Air hunger, B. Exertional dyspnea, C. Cough with night sweats, D. Persistent cough. And the answer is D. Persistent cough. For the client with bacterial pneumonia, the nurse expects the finding of A. Normal white blood cell count, B. Atelectasis, C. Productive cough, D. Unremarkable chest X-ray. And the answer is C. Productive cough. Extended neck vein, viral chest, dyspnea are typical features of A. Asthma, B. Bronchitis, C. COPD, D. CCP. And the answer is C. COPD. Blue bloater and puffer is also known as A. Chronic bronchitis, B. Chronic asthma, C. Acute pneumonia, D. Emphysema. And the answer is A. Chronic bronchitis. Most common finding after splenectomy is A. Pain in expiration, B. Pain in inspiration, C. Shortness of breath, D. Dry cough. And the answer is B. Pain in inspiration. What is the normal PaCO2 level of arterial blood? A. 35 to 45 mm of Hg, B. 80 to 100 mm of Hg, C. 20 to 26 mm of Hg, D. 7.35 to 7.45 mm of Hg. And the answer is A. 35 to 45 mm of Hg. What is the dangerous complication of prolonged use of mechanical ventilators? A. Cardiac arrest, B. Ventilator-associated pneumonia, C. Respiratory alkalosis, D. Hypotension. And the answer is B. Ventilator-associated pneumonia. Which test should be performed before doing arterial puncture at radial artery? A. Allen test. B. Romberg test. C. Quicken state test. D. Caloric test. And the answer is A. Allen's test. A client with bacterial pneumonia is to be started on antibiotic therapy. Which of the following tests must be completed before beginning antibiotic therapy? A. Urine analysis. B. Sputum culture. C. Chest radiography. D. RBC count. And the answer is B. Sputum culture. Best action after bronchoscopy is A. Place the ice chips in the client's mouth. B. Give less amount of fluid. C. Keep in semi-flower position. D. All. And the answer is B. Give less amount of fluid. At the time of fluoride tapping, the physician drains 1000 ml of fluid. The priority nursing intervention is A. Check BP. B. Provide antibiotic. C. Provide chest physiotherapy. D. Connect nebulizer. And the answer is A. Check BP. Presence of acid phosphorus in the sputum is symptoms of A. Influenza virus. B. Diphtheria. C. Bordetella pertussis. D. Mycobacterium TB. And the answer is D. Mycobacterium TB. Purified protein derivative (PPD) is used to do A. Montauk's test. B. Pulmonary function test. C. Antitrypsin test. D. ABG analysis. And the answer is A. Montauk's test.